The wonders of modern technology. Delighted to be here with you today. I'd like to share with you some of my research and clinical strategies for coronary artery heart disease, which, if the truth be known, is nothing more than a toothless paper tiger that need never ever exist. And if it does exist, it need never ever progress. This is a completely benign foodborne illness. Now, let's see, 7 years ago, I wrote an editorial for the American Journal of Cardiology, and it was entitled, Is the Present Therapy for Coronary Artery Disease the Radical Mastectomy of the 21st Century? Now, what did I mean by that? In 1882, William Halsted at Johns Hopkins Hospital devised the operation for breast cancer called the radical mastectomy that was going to completely get rid of all the disease. This operation removed the entire breast, all the skin over the breast, the muscles all underneath the breast, radical dissection of the lymph nodes in the arm. It was disfiguring, painful, mutilating, and many women preferred to watch the lump in their breast rather than have the operation. Now, it was interesting that for 100 years, that was a standardized surgical error. And in the 1970s, we began to have courageous young physicians begin to challenge this operation. And that raised a lot of hoopla. But it was very clear that randomized control studies clearly showed that lesser operations were equally effective. And my point in writing that paper was that, are we approaching that same rut in the treatment for cardiovascular disease? Because for the last 40 years, we have had pills, we have had drugs, we have had procedures, and we have had operations. And remember that 40 years ago, that cardiovascular disease was the leading killer of women and men. And today, 40 years later, what is the leading killer of women and men? Cardiovascular disease. So the problem here is quite simply is this. There has been a basic covenant of trust between the caregiver and the patient since the days of Hippocrates, that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly today in cardiovascular medicine, that's not being done. You're given pills, you're given procedures and operations which have absolutely nothing whatsoever to do with the causation of the illness. And so I think that there are a number of us who are trying to challenge that and really have the public understand what is the causation of the illness, as well as our cardiovascular colleagues. Now, if you were a cardiac surgeon and decided to hang out your shingle in Okinawa, rural China, the Papua Highlands, Central Africa, the Tarahumara, forget it. You better plan on selling lollipops. Why? They don't have any cardiovascular disease there. Why? Because they're all thriving on whole food, plant-based nutrition without oil. Now, so we really, in medicine, have to hang our heads in recognition of the fact that we have constructed a billion-dollar healthcare industry in this country around an illness that does not even exist in half the planet. All right. Now, this is probably the oldest slide I have in my presentation. I took it when I was leaving Vietnam in 1968. And what it does is it reminds me to share with the audience When we autopsy in Korea our GIs who died in combat, at average age 20, 80% of those young men already have gross evidence of coronary artery disease you could see without a microscope. Really, in 80% of those GIs. Not enough for their cardiac event, but that study was then repeated again, this time in 1999, looking at young women and men between the ages of 17 and 34 who have died of accidents, homicides, and suicides. Now, the disease is ubiquitous. Everybody. Not enough for their cardiac event yet, but here you are. You graduate from high school in this country. You get a diploma, and you also get the foundation for heart disease. Now, this is where I always have fun. As I look at the audience now, is there anybody out there who's over 17? It's always more exciting when I'm speaking with patients. All right. Now, we had a chance. We had a chance to get it right, historically, in World War II. In World War II, when the Axis powers of Germany overran the Low Countries of Holland and Belgium, and they occupied Denmark and Norway, characteristically, the Germans would take away their livestock for their troops. So their cattle, their sheep, their goats, their pigs, their chickens, their turkeys, gone. Suddenly, these Western European nations now were thriving on plant-based nutrition. And it was really quite interesting when Drs. Strom and Janssen, in 1951, reporting in England's leading medical journal, The Lancet, they looked at Norway during this time period, the number of deaths from heart attack and stroke. So let's do this together. Starting on the left, here we see in 1927, heart attack and stroke deaths in Norway going up. 1930, going up. 35, going up. 1939, 40. Whoop, in come the Germans. Whoop, 41. Whoop, 40. Who knew these Germans were these great public health educators? And suddenly, here we have, in 1945, the death of Adolf Hitler, the cessation of hostilities in the European theater. But then look what happened. Back comes the meat, back comes the dairy, back come the strokes, back come the heart attacks. Look how rapidly that happened. And yet, we just didn't get it. Okay? Now, obviously, those of you who are looking at this recognize that on the right, this is a severely ill artery. And you're probably saying to yourself, when this tiny little opening closes, there'll be a heart attack. Well, actually, no. Yes, this type of lesion is going to give you, this type of lesion is going to give you a lot of chest pain, angina, shortness of breath. But a heart attack, no, maybe 10% of heart attacks occur from something like this. Because what happens is, as this has taken decades and decades to develop, this doesn't happen overnight. Because in this blockage here, there is muscle, there is calcium, there's cholesterol, there's fibrous tissue, inflammation, and even fat. But as this blockage slowly increases, the downstream heart muscle slowly is being deprived of oxygen and nutrients, and it often decides to try to build its own bypass. So, not infrequently, when patients come in for an angiogram, they'll find, even if they've got 100% blockage here and they've never had a heart attack, why? Because as that blockage slowly develops, there will be these tiny little collaterals going around the outside of it. And you can see these on an angiogram, these little threads. We call these collaterals. And the collaterals are sufficient so that when this finally closes off, the downstream heart muscle has enough blood supply from these tiny little collaterals to retain its viability. Not enough, obviously, that's normal, but it's interesting. Now, the point of this on the left, this is obviously a normal artery. And even those of you in the back of the room can see this tiny little dark line, which I cannot emphasize enough. All experts in this disease would agree that this tiny little dark line of endothelial cells, endothelium, the endothelium is truly the life jacket and the guardian of our blood vessels. Why? Because it manufactures an absolutely magic molecule of gas, which is the great salvation and protector of our vasculature, and I'll talk about that in a moment. But the first thing that happens when you have the milkshake, when you have the pizza with cheese, when you have cheeseburgers, all these cellular elements within your bloodstream suddenly begin to get sticky. It's like a tsunami going off in your bloodstream. If you look at your serum then, it would all be creamy and white with fat. And when these things get sticky, nasty things begin to happen. Now, in this next slide, this is from Peter Libby from Harvard. Now, even though I went to Yale, we do look to Harvard for great help at times. And to orient you, this is where the blood is flowing. These little purple cells that separate the flowing blood from the artery wall are your endothelial cells. Okay? Now, let's do this together. In the upper left, you will see the artist has drawn these little orange particles. This is your bad LDL cholesterol, which is now, since you've had the milkshake and the pizza, it's now sticky. And it bumps up against the sticky endothelium. And when there is an aperture, a cleft, an opening, now we have this sticky LDL cholesterol migrating through the endothelial cell wall into the subendothelial space, where they no longer are orange, they all are yellow. Why? Because the artist is pointing out that the LDL cholesterol, once it's in the subendothelial space, is now oxidized. It's oxidized by these nasty free radicals, many of which are there from the food we're eating. And the subendothelial space does not like these small, hard, dense LDL cholesterol particles, calls upon our SWAT team, the white blood cells, which Peter Libby from Harvard here has painted blue in honor of Yale, and we'd like that. Now, so here is the SWAT team, in the subendothelial space. This macrophage is busy doing its job of gobbling up all these small, hard, dense LDL cholesterol particles until it gets all the way over to here, where we in medicine do what we do so often to confuse you. We change the name. It's no longer called the macrophage or the SWAT team. It is now a foam cell. And the foam cell is truly the Darth Vader of this sequence of events, okay? Why? Because what the foam cell does, it elaborates these nasty enzymes we call metalloproteinases. Metalloproteinases such as stromatolin elastase, collagenase, myeloperoxidase. What's so bad about them? What they do is they progressively thin out the cap over the plaque. it gets thinner and thinner and thinner until the sheer force of blood racing over that tears it. Now here that seminal moment has occurred. You have ruptured your plaque. When you've ruptured your plaque, the plaque content now begins to extravasate out, ooze out through that rupture. And as it enters into the flowing blood, it activates our platelets and clotting factors. And bingo, in a few minutes, we now start to form a clot where that plaque has ruptured. And the clot is in and of itself self-propagating. So in a matter of further minutes, we go from an artery which was 35% blocked. You don't get any symptoms from that. You don't get symptoms until you're over 75% blocked. We go from 35% blocked all the way over here, suddenly, 100% blocked. There's no time for collaterals to develop. And so suddenly all this downstream heart muscle is immediately deprived of oxygen and nutrients, and that's 90%. 90% of your heart attacks with plaque rupture. Okay? Now, if I do my job correctly with you today, every one of you, and hopefully your friends or relatives, can make themselves heart attack proof. How are you going to make yourself heart attack proof? We're not going to do it with a drug. We're not going to do it with a pill. We're not going to do it with a procedure, stents. We're not going to do it with an operation, bypass. You're going to do it when you change your biochemistry. How are you going to change your biochemistry? With food. What kind of food? Whole food, plant-based nutrition. And if you do this entire sequence of events that I've just gone through with you is going to be eliminated. If you're eating whole food, plant-based nutrition, things do not get sticky, sticky, sticky. You do not have migration of your bad LDL cholesterol into the subendothelial space. You do not have the development of the SWAT team coming in and forming the foam cell. If you do not have the foam cell, which tries to thin out your cap over your plaque, you in turn are going to strengthen the cap over your plaque. And if you strengthen the cap over your plaque, it cannot rupture. If you cannot rupture your plaque, you have made yourself heart attack proof. How long do you think that takes? 3 weeks. 3 weeks. All right. Pretty exciting stuff. Now, just when you thought I might have been through with the endothelial cells, here we go again. Why? Because up until 1980, we used to think of the endothelial cell as these cute little red bricks that were lining these wonderful pipes of ours. And the interesting thing is that in 1980, that all changed. Why? Because Dr. Furchtgott, working in Brooklyn, was taking the largest blood vessel of a rodent, the aorta, and he would make this sort of spiral staircase, elliptical cut right through this aorta, through the endothelial cells, immersed it in a bath of saline, and it would constrict, vasoconstrict. One day, no cut, no injury to the endothelial cells. Immersed that aorta into saline, it dilated. Did it again, it dilated. Now the race was on, globally. What was the EDRF that Dr. Furchtgott had discovered? Endothelial-derived relaxation factor. Rolls right off your tongue. Thank heavens that term was with us only 8 years. At the end of that 8 years, Dr. Furschott, Dr. Luignaro, and Dr. Murad discovered that the EDRF was a gas, nitric oxide. For that discovery, those three men in 1998 received the Nobel Prize. Now, what makes nitric oxide in all of us so special? One, nitric oxide keeps all those cellular elements in our bloodstream flowing smoothly like Teflon. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, dilate, nitric oxide. Number three, nitric oxide keeps the wall of the artery from becoming thickened, stiff, or inflamed, protects you from getting high blood pressure, hypertension. Number four, this is the absolute key. Number four, a normal, plentiful amount of nitric oxide will protect you from ever developing blockages or plaque. So literally, everybody on the planet, whether it's in Berlin, London, New York City, Chicago, or Melville, has their cardiovascular disease because by now, in preceding decades, they have so sufficiently trashed, injured, and compromised their endothelial cells, they aren't making enough nitric oxide to protect themselves. Number five, nitric oxide can prevent the smooth muscle of the artery wall from migrating into the plaque. And number six, nitric oxide can destroy the foam cell, Darth Vader. Now that's a pretty remarkable bit of information. And as I look out at this audience right now, I can see some of you saying, gosh, kind of wonder what my level of nitric oxide is. Well, if you go to a doctor's office, it's going to be pretty hard to have that measured because there is a $30,000 Israeli machine that will do that, but most physicians don't have that. And if you're eating plant-based, you really don't have to have it measured. But from a research standpoint, what is done is you take an ultrasound probe and you place it over the brachial artery at the elbow, and there on the screen will be the diameter of the brachial artery. Then, for 5 minutes, you will encircle your upper arm with a blood pressure cuff, all right? And inflate it above systolic blood pressure so that for 5 minutes you have absolutely zero blood flow to your forearm and hand. I've done that. It's not exactly habit forming. Then you release the cuff and immediately with the ultrasound probe, remeasure the new diameter of the brachial artery. And in a normal individual, it'll be 30% greater. So the next great thing that happened was that Dr. Vogel, chairman of cardiology at the University of Maryland, took a group of healthy young subjects to a certain fast food restaurant characterized by arches, which are golden. Half of them got the cornflakes, okay? Brachial artery tourniquet test, normal. The other half got the hash browns and sausage. Within 120 minutes with the brachial artery tourniquet test, those healthy young people couldn't dilate the artery. Now, being young, as they followed them in to the late afternoon, early evening, they began to recover. But think of it, that one meal of hash browns and sausage had so dysfunctionalized their endothelium, they couldn't dilate the artery. Just imagine when Americans start eating the hash browns and sausage. We start when we're young, yeah. As a matter of fact, imagine those people after they've finished that experiment with Dr. Vogel. The very next morning for breakfast, it's going to be scrambled eggs and bacon. At lunchtime, they'll have white bread with cold cuts and some mayonnaise. Supper time, how about a baked potato with sour cream, vegetables soaked in butter, lamb chops, ranch dressing on the salad, ice cream for dessert. Here in the good old USA, we take those delicate endothelial cells and we just hammer them and smash them and injure them right around the clock, because your body's just beginning to clear up what goes on, what you did, the harm you did in breakfast, and you hammer it again with lunch. You clear that up and hammer it again at supper. And then you'd always have that midnight snack of ice cream, hammer it again until you get to breakfast. So it's no surprise that this is sort of a universal illness in the West. All right. Now, this is just a review for you to recall. We've just talked about the various functions. It prevents, that is, of nitric oxide, prevents stickiness, strongest blood vessel dilator, avoids arterial thickening, prevents blockages, prevents smooth muscle migration into the plaque, and destroys foam cells. Now, today I have time just to share with you one of these absolutely wonderful defense factors that we have within our body. These are absolutely all marvelous components and really deserve another discussion themselves. But what I want you to get from this slide is the fact that absolutely every single one of these natural defense factors is going to be totally optimized when you are consuming whole food, plant-based nutrition. So now it's time to shift gears a little bit, and I want to share with you a couple of studies that I was in, because when you think about it, the key here is, it's one thing to sort of share with you the science, but I think it's important to know about the results. Now, this first study was a small one because when I started back in 1985, I was still actively involved as a surgeon. And I just had to obey or adhere to my surgical responsibilities. So this was a small study. And you might be wondering, how in the world does a general surgeon get involved with nutrition? And I should share with you that in my job as head of the breast cancer task force in the late 1970s, early 80s, I was becoming increasingly disillusioned with the fact that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. And that led me to do a bit of global research, and it was quite striking to see countries like Kenya, where breast cancer rates are 30 and 40 times less frequent than the United States. And if you looked at rural Japan in the 1950s, breast cancer was very infrequently identified, and yet as soon as the Japanese women would migrate to the United States, by the second and third generation, still pure Japanese American, they now had the same rate of breast cancer as their Caucasian counterpart. And perhaps even more compelling was cancer of the prostate. In the entire nation of Japan, in 1958, how many autopsy-proven deaths were there from cancer of the prostate? 18. Perhaps the most mind-boggling public health figure I've ever heard. By 1978, as they kind of westernized, they were up to 137, which still pales in comparison to the 28,000 that'll die this year in this country of prostate cancer. So it was about this juncture that I felt I was seeing so many cultures where cardiovascular disease was virtually non-existent. And since it was the leading killer of women and men in Western civilization, I just felt that there would be more bang for the buck if our research was on cardiovascular disease. And the dream was that if we ever get people to eat to save their heart, then they're likely to save themselves from the common Western cancers of breast, prostate, colon, and perhaps pancreatic. So here I was, 1984. I knew I was going to do this study, but I was a cholesterolholic. I'd grown up on an Aberdeen Angus beef farm and a dairy farm, and I really kind of love these foods. Because let's face it, the Western diet looks delicious. The Western diet smells delicious. The Western diet tastes delicious. And while it is destroying you, it is painless. So I knew I was going to do this study, but as you maybe I recall, Dr. Prochaska from Rhode Island has defined in those who are going to do a lifestyle change, we go through a number of phases: pre-contemplation, contemplation, action, maintenance. So I was over here somewhere around contemplation, and I can remember with the month that it happened. It was 1984 in April, and I was attending a surgical meeting with my wife Ann in New Haven, Connecticut. And God, the papers were just boring, and the weather was rotten. But they always have a banquet after these conferences. And at the banquet, this waitress put this plate of roast beef in front of me, and it was just draped over the sides. And I just looked at this and said, "This is it." And Ann looked at me and she said, "You're not going to eat your roast beef?" I said, "No." She said, "Well, then here, I'll have it." Now, Ann's mother had died of breast cancer at age 52. And 2 weeks after that meeting, her sister came down with breast cancer. And then she looked at me and said, "I'm with you." So we did it ourselves for a year, and then I was happy with the results that we were seeing. I went in August of 1985 to Bill Sheldon, who was head of the Department of Cardiology, asked the cardiologist if they would be willing to send me 24 patients seriously ill with heart disease, and I'd like to try to encourage them to eat plant-based nutrition. And so over the next year and a half, I got these 24 patients. And as my late brother-in-law used to say, these were Essie's walking dead. They had failed their first or second bypass. They had failed their first or second angioplasty. They were too sick for these procedures, or they had refused. And there were 5 who were told by their expert cardiologist they wouldn't live out the year. But I'm happy to say those 5 all made it beyond 20 years. And we began to suddenly see wonderful things beginning to happen. Not only did their symptoms go away, but when we carefully studied them, they were actually beginning to reverse their disease. Now, a couple of key points here in all of this. I was fearful that the rock upon which this study was most likely to flounder was lack of patient compliance, because I was asking them to make a very, very significant lifestyle change. And therefore, although I was not a trained psychologist, I decided to use for these patients the same mantra that I had been using for my cancer patients, a mantra that I had learned about from a wonderful West Coast surgeon by the name of Bert Dunphy. And Bert Dunphy said that patients with cancer are not afraid to suffer. Patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or by their physician. So for the first 5 years, I saw each of these patients every 2 weeks in the office, where I would go over every morsel they ate, check their cholesterol, weight, and blood pressure. At the end of 5 years, I became a little bit more courageous, and I stretched it out to seeing them monthly. Most cardiologists see their patients twice a year. At the end of a decade, they were all pretty well now on autopilot, and I was able to stretch it out to quarterly. And then at 12 years, we reported those original results, which I think, although the study was certainly small, made it the longest study of its type. 12 years is getting close to half a career. So it was exciting to see those results. Now, a couple of rules that I want to share with you that I feel very strongly about is avoiding any drop of any food that has been shown to injure the capacity of the endothelial cell to make nitric oxide. So not a drop of any oil. Olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures the endothelial capacity to make nitric oxide. There are numerous well-done, peer-reviewed studies that confirm that. And anything with a mother or a face, meat, fish, fowl, turkey, eggs, and anything that is sugary, Cokes, Pepsis, Diet Colas, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey, and anything that is dairy, milk, cream, butter, cheese, ice cream, and yogurt. I don't like coffee with caffeine. Decaf is okay. Interestingly enough, tea with caffeine, okay. Coffee with caffeine, no. Now, here it is, for those of you who are worrying about this oil. Peer-reviewed scientific study. Olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. Now, this is work from the Cleveland Clinic, and this is work by Stan Hazen and his team, who were interested in the molecules of lecithin and carnitine, which are found in these animal products that you see listed here. Now, what seems to be the case is this. If you are an omnivore, as an omnivore and you are eating these animal products, you have now developed in your gut, in your bacteria, in your microbiome, you have got bacteria that when they metabolize these animal products, you're going to get production of a molecule called TMA, trimethylamine. And that trimethylamine will be rapidly oxidized by your liver to trimethylamine oxide. And trimethylamine oxide raises havoc with your blood vessels. That's your argument when you run into somebody who is paleo. Because here is the schematic for you. You eat the lecithin and carnitine in the animal products. Your gut bacteria ends up with your body making TMAO, vascular disease. Well, what is it so exciting about this is that when Stan Hazen took persons who were totally plant-based and he fed them a lamb chop, then he measured their blood. No TMAO, or very little. But if you eat that lamb chop 4 days in a row, then you now have joined the ranks of those who have bacteria in your gut, which will make TMAO. Now, here's what TMAO does to your vessels. decreases your capacity for reverse cholesterol transport, increases deposition of cholesterol in the arterial wall. And when Stan Hazen and his team looked at the serum from 4,000 patients who had gone through the Department of Cardiology at Cleveland Clinic, as they followed them, those that had the most severe cardiovascular disease events were those that had the highest rates of TMAO. And everybody always talks about, well, I eat fish. Well, wait a minute. Fish yields, when you eat fish, that's when you get the highest levels of TMAO. And here we have sort of an antidote to TMAO is dimethylbutanol. And it's found in balsamic vinegars and red wine. But that isn't going to do it. You're so much better off having bacteria in your gut which do not have the capacity to make TMAO. All right. Now this is going to take a minute because this was an article in the New England Journal of Medicine by Dr. Paul Ridker from Harvard. It was reported at the European Heart Meetings in Barcelona this summer. And it's an interesting study because there's been a lot of concern of how much coronary artery disease is caused by cholesterol and how much is caused by inflammation, or is there a combination? Now this is fascinating because here's what happened. This was several thousand men who had had a heart attack. And we know they had inflammation because they had their HSCRP, the highly sensitive C-reactive protein measured, and it was all over 2 to qualify for the study. So they had inflammation. Some of the group were placebo. Then the other group, there were 3 different doses of a drug called canakinumab. And canakinumab is usually used for children who have juvenile arthritis. It is a very strong anti-inflammation type drug. And there were 3 different levels, 50 milligrams a day, 150, 300. Interestingly enough, at the end of the study, one of those groups, the 150 milligram dose of canakinumab in these people who had previously had heart disease, as they followed them for 5 years, there was a significant reduction in cardiovascular events in that group, in the group that was getting 150 milligrams. But what was fascinating about that, when they measured the LDL cholesterol, the bad cholesterol in that group that decreased their cardiac events, no change. They didn't drop their cholesterol at all, and here they significantly got rid of further cardiac events. Now, the problem with this was the drug was expensive, $200,000 a year, and it had some side effects. Death. Death because it so suppressed the immune system that the people were dying of sepsis, all right? Now, what is so fascinating about this study, it just absolutely almost tells us what we know already about how whole food plant-based nutrition works. There is nothing that is more anti-inflammatory on the planet than whole food plant-based nutrition. And guess what? It doesn't cost anything. You got to eat. And there are no hideous side effects. And at the same time that it eliminates inflammation, you drop your cholesterol, the best of both worlds. Pretty exciting stuff. But I don't know why it is that even sophisticated investigators think about using a prohibitively expensive drug with ridiculous side effects rather than resort to the dignity of simplicity of simply eating food that has been shown for hundreds of years throughout the planet to protect you from ever developing this common killer of those in the West. All right. Now, so what are you going to eat? You're going to eat all these marvelous whole grains for your cereal, bread, and pasta, 101 different types of legumes, lentils, and beans, all these marvelous red, yellow, and green leafy vegetables, white potatoes, and especially sweet potatoes, and some fruit. Now, something that I've probably that I've gotten the reputation of being a bit of a taskmaster about is, this is something we've started just in the last 6 years. Let me just parenthetically make a comment. There have been some people who will say, well, Dr. Esselstyn, your diet is just too extreme, severe, strict, draconian, and people aren't going to follow it. I love it when I get that question. First of all, we have found that now over 1,000 people in Ohio who have come to see us are following this. It's not at all different, really, in a sense, basically, from the diet that is found in half the planet where this disease does not exist. And so when somebody challenges me that it's being extreme, my response is, let's be clear about one thing. The most extreme, severe, calamitous diet on the planet today is the one that 97% of Americans are eating every day, that literally guarantees that before they will die, they'll have some hideous chronic illness. That is the extreme diet. Okay. Now, so what we've added in the last 6.5 years, and this is not in my book, and that is that I ask patients with heart disease, just imagine if you could get your head inside those arteries to your heart that are blocked, what you would see would be an absolute cauldron of oxidative inflammation. So we need antioxidants. No, I don't want you to go down to the health food store and buy a jug of pills that says antioxidant, because it's not going to work and it's going to be harmful and probably expensive. No, I want you to get your antioxidants from food. Okay, what food? Food that is high in what we call ORAC value. O-R-A-C, oxygen radical absorptive capacity. Another one of those that just rolls off your tongue. So, if you're having raspberries, blueberries, strawberries, and blackberries on your morning oat cereal, terrific. But nothing trumps the antioxidant value of green leafy vegetables. So I want my patients now to chew, not smoothies, not juicing. I need them to chew a green leafy vegetable that is roughly the size of their fist after it has first been boiled in water 5.5 to 6 minutes, so it's now nice and tender. And then they must anoint it with several drops of a delightful balsamic vinegar. Why? Because the acetic acid in the vinegar has been shown to restore the nitric oxide synthase enzyme contained within the endothelial cell that is responsible for making nitric oxide. So, I want you to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, mid-afternoon, 4, dinner time, 5. God, I adore it when you have that evening snack of kale. What are you doing? All day long, you are basking and you're bathing that horrible oxidative cauldron of inflammation with nature's most powerful antioxidants. Right. Now, another reason for this. You know by now how important nitric oxide is. And we know that if you take somebody who's age 50, beautifully healthy, compare their nitric oxide production with what they produced when they were age 25, It's 50% of what it was, just from age alone. Now, does this mean that the old carcass is going to let you down? No. You have another avenue for making nitric oxide. What's that? Your gastrointestinal tract. How does that work? Well, again, if I can get you to chew these nitrates, these green leafy vegetables, they are nitrates. When you chew them, and they mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue, especially if you're not using some horrible mouthwash, those facultative bacteria will reduce the nitrate in your mouth to nitrite. Now, when you swallow the nitrite, your own gastric acid will further reduce the nitrite in your stomach to nitric oxide, which can now enter your nitric oxide pool. Those nitrites in your stomach, which did not get converted, further down the GI tract, they are reabsorbed into the circulation. And when they circulate through your salivary gland, they will be concentrated 10 to 20 fold. So now when you chew additional food, your own salivary glands are pouring nitrites into your mouth, which when swallowed will further be reduced by gastric acid to more nitric oxide. Pretty exciting stuff. No oil. Now I want to review with you just briefly some angiograms that were done, because this will show you scientifically how the disease reversal occurs with an angiogram. This is a 67-year-old retired pediatrician, and you're looking at the left anterior descending. This is as small an improvement as the eye can see from the left here over to the right here. A little easier to see in this 58-year-old factory worker, where you're looking at the circumflex artery to the back of the heart. This was described as a 20% improvement from here over to here. A little easier to see yet in this 54-year-old security guard, the right coronary artery, and here, this was described as a 30% improvement from here to here. Now this is a surgical colleague, friend of mine. This is Joe Crow. In 1996, Dr. Crow began to get chest pain. Mm-hmm. So cardiology worked him up and could find nothing in October of 96. And Joe had a cholesterol of 156. He was not diabetic. He was not hypertensive. Did not have a strong family history. He was not overweight. He exercised regularly. So 4 weeks later, November of 1996, he finished his surgical schedule, and he sat down to write postoperative orders. The elephant suddenly sitting on his chest, pain in his left jaw, shoulder, arm, having a heart attack. Whip down to the cath lab, start the catheterization, cardiac arrest, resuscitate, finish the catheterization, one more cardiac arrest, resuscitate. Then he's sent up to the floors where he stabilizes, and he's discharged 3 days later, but very depressed. He was depressed, why? He was depressed because at the time of the angiogram, they were able to find that the entire lower 1/3 of his left anterior descending coronary artery, the widowmaker, was all moth-eaten and diseased over this segment. And you cannot just ram in and jam in stent after stent after stent. And it was too far down the artery to have a bypass. So Joe was very depressed. So Ann and I had Joe and his wife out for dinner 2 weeks after his heart attack. Ah, Joe, come on. You've been eating this typical Western diet. You've got the typical Western disease. Why don't you think about going plant-based? We've got 10 years of data. Okay, yes, I'll give it a shot. But I'm not taking any of those statin drugs. I don't trust them, too many side effects. Hey, not a problem, that's your call. He became the absolute personification of commitment to plant-based nutrition. And over the next 30 months, his total cholesterol plummeted, his LDL went from 98 to 38, and then he had another angiogram. Now, up in the surgical suites, my office was 3 doors away from his. So at noontime, I went over to his office, opened the door, and there he was, sitting behind his desk. I said, Joe, I understand you had the follow-up angiogram earlier this morning. You mind sharing with me? How did it go? He said, well, he came around, put his arms around me, a couple of these. He said, I think we're doing okay. I said, well, would there be any chance that I could see the angiogram? Yes. Now, what really, this is not going to happen to everybody. But when the plaque is young and soft and made up of inflammation, fat, and cholesterol, the body can do a remarkable job of reconstituting itself. When the plaque has been there for decades and it's filled up with scar and fibrosis and calcification, you're probably not going to budget much. Maybe a little remodeling. You'll certainly help the vessel wall around it. But it's going to be my job today to make sure that you understand that even those patients where you will not see this type of dramatic reversal, even those patients are going to reverse their disease in a manner where they can return to full activities of daily living without restriction, and we'll get to that in a few moments. Actually, maybe a few minutes. Now, what was particularly interesting was that I wanted to know, in the 18 patients who stayed with us throughout the 12 years, I wanted to know how many cardiovascular events that they had had while they were in the care of expert cardiologists during the 8 years prior to coming into our study. They had these progressive events of disease you see listed here, and these 49 events. Now, these 18 patients, once they came into our study, over the next 12 years, 17 of those 18 had no further events. We did have one little sheep who wandered from the flock. After 6 years, got into the lamb chops and the glazed donuts, French fries, more pain, bypass. Now he's back with the flock. But he proves the point that I'm trying to share with you today. Now, we got pretty well hammered by the critics about our study, although it was published scientifically in a peer-reviewed journal. The critics were saying, this is a small study. Dr. Esselstyn, your diet is extreme. How do you know that you can have this happen with a larger group, and can you get similar results? So in July of 2014, in the Journal of Family Practice, we submitted our study of 200 patients. 2 were lost to follow-up, 198. So the main thing was, would they comply? And adherent were 89.3%. That's almost 90% who were adherent to this diet that others. Now look, a couple of words here about this, because people, one of the most common criticisms that I'll get is that physicians will say, Dr. Esselstyn, I've tried your program and my patients just won't stick with it. Why is it that we succeed? It's not that the message is wrong. It's how the message is articulated. How do you get patients to change? Well, I think the most important thing you do is you show a patient respect. And the only way that I know to show a patient respect is to give them my time. So what we do today, because now close to 85 or 90% of my patients seem to come from outside the state of Ohio. And they cannot come to Cleveland for days and days at a time. So we, a number of years ago, felt obligated to synthesize and put together a single day 6-hour intensive seminar where these patients are going to learn all about how they created the disease and how they are going to be empowered. Empowered as the locus of control to halt and reverse their disease. In addition, everybody gets a very hefty notebook with DVDs about the entire seminar. And it's really very exciting. We have a portion of it, the 3 hours of science. Then Ann does a wonderful presentation on acquiring and preparing plant-based foods. And then we have 3 marvelous previous participants who've had a successful result share their experience with those in attendance who can then say to themselves, listen, if he or she can do this, I can do this. Then we have a delightful plant-based luncheon and stay in touch as necessary through email or phone call. Now, I'm probably at that presentation with these patients. Oh, and I should mention, my secretary will give me a list, usually 10 days beforehand, with all their phone numbers, so I have an opportunity. I'm old-fashioned enough that I insist on personally calling each of them myself so that I can get my arms around their story, and at the same time, they have an opportunity to ask questions of me so that coming to the seminar, we have a strong platform from which we can all move forward. Now, where do I throw the hook? Where I think I throw the hook with these patients, I must spend close to an hour on the endothelial cell. Why? Because everyone there with cardiovascular disease, whether they're trying to avoid a stent or a bypass, they've had one, they don't want another one, had a heart attack, they don't want another one, or they've been told they have a strong family history, they have got to understand that the very reason they have their disease, they created it. They created their disease by destroying the capacity of their endothelial cells to make sufficient nitric oxide. And they have to understand that this is not a malignancy. Once you stop injuring the endothelial cell, it comes back, makes enough nitric oxide, you can not only stop the disease, but begin to reverse it. So they have got to get that. They have got to get the fact that they produce the disease and they are empowered. Now, one of the things I have to do to make that happen is have a little fun with them. Maybe I'll pick somebody out of the audience and say, how many days do you eat out? Oh, not very often. Let's try that again. How many days do you eat out? Well, Dr. Esselstyn, maybe 3 times a week. Okay, 3 times a week. What are these famous restaurants in Dallas that you go to that are known for the arrest and reversal of heart disease? Okay. I didn't look at it that way. But I don't eat much oil. I said, wait a minute. I don't have a program that is 90% or 95% compliant. If I get a phone call and somebody says, Dr. Esselstyn, you'd be proud of me. I'm following your program 85%. I said, I don't know whose program that is. That's not my program. If you've got an endothelial cell system that is already an absolute train wreck, so it can't protect you from having a heart attack, why in the name of anything would you ever want to further destroy your train wreck and have a second heart attack? Oh, okay. Now we say, look, there are 4 reasons to eat out. 1, you don't have to do the cooking. 2, you don't do the dishes. 3, the ambiance. 4, the companionship. You never, ever go out to further destroy more endothelial cells. Okay? Well, Dr. Esselstyn, what if I'm asked out to somebody's house? I said, fine, if it's a large gathering and it happens to be a buffet, you eat before you go, or you eat when you come back, but while you're there, get the old plate out, put on all those foods that are going to destroy you, play with them, turn them around, mush them, and you're there for the ambiance and the companionship, but you never eat them. No, but Dr. Esselstyn, you don't understand. Suppose it's a small gathering. It's Ruth and Bill. They've been our friends for years. They're having 6 of us over to sit down. So, well, this is when you depend upon your interpersonal skills. You talk to them and you say, listen, Ruth, Harriet and I have been your friends for years, but I have this situation, and I'm being cared for by this absolute monster in Ohio. Oh, okay. Well, you get the point. This is how you absolutely get rid of this disease. And when you suddenly remember that really these patients want to get well, and if you're willing to show them how to get well, give them the science and vocabulary that they can grasp. They don't have to have every last molecule of the science understood. But that's why I've chosen, what all experts would agree, is where this disease has its initiation is when we run so low on nitric oxide, we don't have enough to protect ourselves. All right, so how do you know the patients in this study were sick? Well, 119 of the 177 who were following had already had a bypass or stents. There were 44 who had a heart attack. But look, this is what to me is most fascinating. There were 27 in that group that were told before they saw us that they had to have stents or an operation. Never have to have it. We're so solid on this now that literally anybody who is having an elective procedure that's not an emergency, because in an emergency nobody disputes the fact that a stent or bypass can be life-saving. But the data are there clearly. When these procedures are offered electively, there's no prolongation of life, and there's no protection from a future heart attack. Now, so of those who are adherent, one patient, while in China, eating off the economy, totally disobeying, had a small stroke. So 0.6%. The other 21 patients who were non-adherent, 62% had additional events. And here what I've done is I've put this into a bit of a bar graph. And what I've compared our results with are some very well-known cardiovascular studies. For instance, here on this are the major cardiac events: heart attack, stroke, and death. Over here, let's start with this Mediterranean diet, the Lyon diet heart study. At the end of 4 years, 25% had had heart attack, stroke, and death. Out of Columbia Presbyterian Hospital in New York, the natural history of coronary disease, 4 years, 20% heart attack, stroke, and death. And Bill Bowden's Courage study, 19%. So somewhere here, 21, 22%. Here we are, 0.6%, over a 30-fold difference. What is going on? What is going on is what we talked about earlier. We are treating the causation of the disease. And there's been this basic covenant of trust since the days of Hippocrates. Whenever possible, the caregiver will share with the patient the causation of the illness. And this isn't done in cardiovascular disease, but I should share with you, just 2 years ago, I was invited to join the Nutrition Committee of the American College of Cardiology, along with several others, Dr. Dean Ornish, Dr. Monica Agrawal, Dr. Robert Osfeld, Dr. Neil Barnard. So the foxes are really in the hen house now. But it's like turning around the Queen Mary. It's tough, because in many ways I'm a threat to medicine's biggest cash cow. All right, pretty clear. Now this is interesting because this is a Harvard study that came out this past summer. And the thing that was exciting, Harvard has had for years this ongoing study of healthcare workers and nurses for over 30 years, and something like over 4 million person years of follow-up. When they divide the way these people are behaving into different grades of quality of plant-based diet, sure enough, what you'd expect, those that were following the closest to the ideal plant-based diet were those that had the fewest cardiovascular events. Now here, this was in July of 2014, this was a study that I was reporting in the literature on only 3 patients. Now, what in the world was I doing writing up 3 patients? The reason for this is that these 3 patients absolutely were demonstrable of the failure of present-day cardiovascular medicine. And it all starts with Dr. Bob Mercer, who was a patient that I have yet to meet personally, although we have exchanged correspondence. And he is from Newfoundland, Canada. At age 44, totally blocked his right carotid, small stroke, 27% blockage of his left carotid. And he had severe angina at that time. They found a wonderful surgeon in Toronto who was able to operate on him. And at the time of surgery, he had great result. And he was fine until he was around 69 or 70. Now he was in real trouble again. Severe angina. He had diabetes. He had erectile dysfunction. He had a measurement of his one remaining carotid artery that was now 90% blocked. And of all things to have happened, his daughter, at age 37, came down with a heart attack. During her convalescence, she happened to find a book called Prevent and Reverse Heart Disease. And she said, "Pop, we got to do this together." They did. A year later, I got a letter from Bob Mercer. "Dr. Esselstyn, I wanted to thank you. I've lost 40 pounds. My diabetes has disappeared. All of my angina has disappeared. My erectile dysfunction has disappeared. And my one remaining carotid that was 90% blocked is now 67% blocked." And here I think we have a picture of Bob Mercer before and after. These are 2 from, interestingly enough, these next 2 patients were seen at the Cleveland Clinic, my alma mater. And it was tragic. Art Soteros, at age 32, overweight, became diabetic. Art Soteros, age 42, the first of 14 stents at the Cleveland Clinic. Then he was told, "This is pretty severe disease. You're going to have a bypass." Had the bypass, that was good for a year and a half. More angina. They gathered around the bed. Nothing further we can do for these. You'll have to see if these drugs don't work. You have this aggressive type of disease. Art found us 7 years ago, lost 40 pounds, got rid of his diabetes, and has no more angina, and he regularly comes to our seminar as one of the people who discusses his results. And the third gentleman is Jim McNamara, locally. Jim, at age 55, small stroke. They said you needed an operation. They operated here, and they finished it off. Totally blocked, unsuccessful. Then he began getting these severe pains in his leg because of partially blocked arteries in his thigh. And he had his first operation, it failed. Second operation, it failed. Third operation, it failed. And he was really miserable. He couldn't even get his leg up to sleep with him. As soon as it got level with the bed, he had the extreme pain. And so his wife found us over the internet. And he came for counseling, totally compliant, and lost 40 pounds, got rid of his pre-diabetic state. All of his leg pain disappeared. He can walk nonstop, and here he is, left before, right, dancing with his daughter at her wedding. And he also is somebody that comes regularly, and he's a wonderful raconteur about his journey with this disease. So, summarizing, this approach compared to the standard, there's no mortality with this nutrition, no morbidity, and the benefits improve with time, and it's not expensive. You're just eating. And the key here is this. Patients who've had a heart attack are walking around nowadays with the sword of Damocles hanging over their head. wondering when they're going to get their second heart attack. Nonsense! You never have to have another heart attack. You can make yourself heart attack proof. All right. Now, what in the world is the good of having a great heart if your brain goes out on you? Not a good plan. But we got really insight into this from Megan Leary and her team from the West Coast, who at the stroke meetings in Miami in 2001, they had looked at over 5,500 MRIs of the brains of Americans. And at age 50, what they begin to see in these brains are these small, tiny little white spots, right? What are they? Little strokes. But you know, age 50, big brain, tiny stroke. Not a problem when you're 50. But now you're suddenly 65. You have had 15 more years of the good old American diet. More often than before, you say, sweetheart, where did I leave the car keys? Well, you get through that. Bingo. You're now 75, 10 more years of the good old American diet. You look at her and you say, are you my sweetheart? Or where's the car? Where's the car? 10 more years go by. You're 85. Now you look at her and you say, are you my sweetheart? I can't protect you from that. You don't suddenly wake up on your 85th birthday with dementia. You work hard all those preceding decades to lay the foundation for that dementia, which does not have to happen. Here, for example, is a normal MRI, and here I counted 90 of these little scars. Can you imagine a message trying to go through all this scar tissue? Now, look at here. Up, right here, that's the skull. There's the brain, big, full brain. But over here, what's this gap? What is this? This is cerebral atrophy. You don't want cerebral atrophy as you get older. How do you prevent it? Exercise. Exercise. If you're going to do this with walking, it's got to be 4 or 5 times a week, fast enough so you're almost ready to break a sweat, or you can bike or swim. And here, what you're looking at, this is an MRI of the thigh muscle of a 40-year-old triathlete. On the upper right, thigh muscle of a 74-year-old couch potato. Lower right, 70-year-old triathlete. Pretty well defines the importance of exercise, right? Now, what you're seeing here on the left, this is a pulse volume. A pulse volume of a gentleman who, when he first started seeing me, crossing the skyway to my office, he had to stop 5 times because of a partially blocked artery in his thigh and pain in his calf. Now, so therefore, we got this pulse volume. On the other hand, I was so concerned about his heart that I forgot all about his leg until 11 months after he'd been seeing me. He said, Dr. Esselstyn, do you recall when I first started seeing you, I was stopping 5 times crossing the skyway to your office because of pain in my calf? Yeah. He said, you know, the last month it got to be 4 times. Then it was 3. Then it was 2. Then it was 1. He said, I don't stop anymore. The pain is gone. Okay, Don. Back you go. Back you go to the vascular lab. Now what you see, the pulse volume is absolutely double what it was. Double. So we now had, unequivocally, for the first time, within 15 months of starting our study, we had absolutely solid, rock solid, irrefutable scientific data that food and food alone could reverse cardiovascular disease. And you're going to say, wait a minute. What about the statin drugs? Well, I'm going to tell you, wait a minute. Because this is 1986. We didn't have any statin drugs then. Now, I've given you 2 examples. Dr. Crow, who refused statins, Don, they weren't around. Absolutely marvelous results. So we increasingly seem to see in our program, there are persons who are there because they cannot tolerate the statin drugs. And they are in no way precluded from enjoying those benefits. Now, here's another. This happens to be a 78-year-old high school retired chemistry teacher. And always, before you start, would you always please turn off your... I'm sorry. Every speaker's nightmare. Okay. 78-year-old high school chemistry teacher, pain because in his retirement, he and his wife they loved to enter square dances. During the fast square dance, he was getting bilateral calf pain. So he saw these vascular surgeons, and sure enough, here was the imaging they got, which clearly shows the disease that was in his aorta and going down to his legs. And he didn't like the idea of the big operation that they had recommended. So he found us over the internet, and he said, Dr. Esselstyn, if I choose your method, how long will it take me to get rid of this calf pain? So I looked at him with great wisdom in my face. And I said, it'll probably be about 10 or 11 months. 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone. Okay. Now, most of you, I imagine, are from the greater New York area. I'm out in Ohio, but I know that when we were watching television, if you're looking at a sporting event, if you're looking at a mystery, just before the advertisement comes on, you will hear the mellifluous tones of the advertiser say something like, when the moment is right, will you be ready? Now, we know that the penile artery is really quite tiny compared to the coronary arteries to the heart. So not infrequently, before somebody comes down with heart disease, they may find they're no longer able to raise the flag. However, all is not lost. Not infrequently, after I've counseled somebody, I'll get a call 10 or 11 months later, Dr. Esselstyn, yes, thought I ought to give you a call because recently something has come up. Wondering if I don't owe you another check. Now, back to the heart. Now here, I promised that before we finished, that I would share with you how do those patients where you can't have the plaque go away, how do they recover? What you're looking at here is a PET rubidium dipyridamole scan, and translation, if it is orange or if it is yellow, that's a good blood supply. Here it is all green, and that is poor, lousy blood supply in this 60-year-old stockbroker with a cholesterol of 248. I counseled him at the time that he had this scan. 10 days after counseling, his cholesterol was down to 130/70. And 3 weeks after this original scan, we repeated it, and it's all back. Now, wait a minute. You don't wash out any plaque in 3 weeks. What's going on here? How did this blood supply get back? Here's what happens. What you're looking at there is the heart without any muscle. The heart in all of its vasculature. Now, the blood vessels that get all of the attention and publicity for stents, for bypasses, are what we call the epicardial coronary artery. The right coronary artery, the left anterior descending, and the circumflex and the main. They ride on the surface of the heart. They're the ones that get the stents and the bypasses, okay? But look at here. There are thousands upon thousands of vessels where they're supposed to be going into the muscle to deliver to the muscle the oxygen and nutrients that they require. Now, one of the problems with this situation is that when you're, let's say somebody comes to see us and they've got this chest pain, and they have this disease, as you now know from what I've said earlier, because they have so sufficiently trashed and injured their endothelial cells. Now your endothelial cell is your enemy. It is no longer making sufficient nitric oxide to dilate, and it starts to make endothelin and thromboxane. These are vasoconstrictors, okay? So I called to the Cleveland Clinic cardiovascular pathologist who all year long, 200 hearts from the deceased he dissects. I said, Rodriguez, how often do you ever see standard cardiovascular plaque in hearts once the vessel has gone into the musculature? Never. Maybe rarely with a severe diabetic. Aha. So here's what's going on. Now we know that when you finally get these people to suddenly change the way they're eating, what happens is all of these thousands upon thousands of vessels that are cascading, they are diseased. They are diseased not with plaque, but they are diseased with vasoconstriction, vasospasm, because they are being affected by the vasoconstrictive molecules of thromboxane and endothelin. And that is why as soon as you get these patients to suddenly stop any further injury to the endothelial cells, they recover. And as they do, they start making nitric oxide. They stop making the vasoconstrictor. And then that's why these patients get rid of their pain and they're able to get back to their full activities of daily living, interestingly, without restriction. So let's summarize the 8 ways that you can have of disease reversal. We've talked today about I showed you the angiograms. You will see that reversing in the stress test. I've shown you the PET scan. We've talked about the ultrasound. We've talked about the pulse volume with the legs, and then the symptoms that disappear of angina, claudication of the leg, and erectile dysfunction. Now, I seem to always finish up with this because for those of you who haven't been to Cleveland, I always like to show what the trees are like in February. And but now that I've actually retired from surgery, part of the Wellness Institute, the budget is more modest, but the morale is really quite high. And one of the things that I've learned since the medical school 56 years ago, perhaps brains are important, but nothing is as important as persistence, 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 best demonstrated by this damsel, Life magazine, 1939, trying to learn how to do the splits. And she stuck with it and stuck with it and stuck with it. And sure enough, the other day, Dr. Shore saw her in downtown Melville, and she got it right. Yeah. Now, so I want to thank you for your patience. And the reason that 16 years since I retired from surgery, I find myself now more passionate than ever about medicine. Why? Because truly we are on the cusp of what could be a seismic revolution in health. When you start eating plant-based, we've talked a lot today about cardiovascular disease, but there are so many other diseases that happen. While you're treating a patient with cardiovascular disease who has hypertension, it's gone. It's diabetes, it's gone. The risk for strokes, gone. The risk for further heart attacks, gone. The same thing seems to be happening with Crohn's disease, ulcerative colitis, rheumatoid arthritis, lupus, multiple sclerosis, allergies, asthma, kidney disease. The list goes on. The heavens have opened and given medicine, the most powerful tool we have ever had in our toolbox. Practically costs nothing because you got to eat. There are no hideous side effects. Yes, it does do away with Pharmageddon, all these drugs. But the only way that this is ever going to take place is we in the profession have the will and the grit and the determination to share with the public. What is the lifestyle? And most specifically, what is the nutritional literacy that will empower them as the locus of control to absolutely annihilate chronic illness? Thank you. I don't know, Steve, do I have time for a question or two?
Okay, yes.
Yes.
Absolutely inspirational talk. Love it. My name is Rita Bhattija. I'm an integrative and functional medicine registered dietitian nutritionist in private practice. Have 2 questions for you. Why Indians suffer from CVD so much in India and here? And second one, when you mention about the oil, are you also saying that one should not eat the raw nuts and the raw seeds and the naturally occurring oil also?
And your question was?
That's my 2 questions. Should we or shouldn't we eat nuts and seeds?
Yeah.
Because you mentioned about the oil, but they were all different kinds of oil.
Yeah, in my book, I'm very clear about that. For patients who have heart disease, I am still an outlier. I do not want them to have nuts. I don't want them to have nuts or peanut butter or cashew sauces and so forth. But if somebody has a bun and it has a couple of sesame seeds in the crust, I'm okay with that. Your other question was about India?
Means can we eat
India.
1 ounce of raw nuts or seeds or absolutely
Well,
not?
there's going to be there's a difference of opinion here. Okay? And let's put it this way. I am delighted to compete our results with anybody on the planet. However, if I am proved wrong that nuts are okay, I have not hurt my patients. You had a question about India.
India, yeah. Why Indians have CVD?
Why do the Indians seem to have? Well, maybe they're more carefully diagnosed. When I was in India in 2000, they are being overrun with heart disease. They do eat meat. They eat all kinds of oil. And they eat, this ghee, clarified butter. Yeah. And again, but you can take an Indian who has heart disease, get him to eat this way, you got him cured.
But what about vegetarians, Indian vegetarians?
Well, vegetarians? Yeah, vegetarians eat French fries. Vegetarians eat oil. Vegetarians eat glazed donuts. Thank you. Yes?
How would you get your DHA and EPA?
Right. How many times have you heard patients going to the emergency room and saying, "My God, help me out. I'm omega-3 deficient." What we like to have our patients do is plenty of green leafy vegetables and put either a tablespoon or 2 of either chia seeds or flaxseed meal on their cereal. Yeah. Yeah, we have to convert. And we haven't, at least when the persons that I've had it checked, I've not seen deficiency. Yeah. Yes?
My question is, my son, he has oral allergies to all kinds of raw foods, fruit, vegetables, and even when he cooks them, they make his mouth all itchy. So just wondering if you had any ideas on that, because I'd like him to eat healthy, but he's, really can't eat that stuff.
Well, I think I doubt that he's allergic to every single one of plant-based foods. And I'll try to find the ones that he's not allergic to that he accept.
Yeah, no, okay, thank you.
Yeah.
Diabetic, 19 years. I went on the plant-based food the last 2 weeks. Tremendous pain of 2 weeks of sugar problems, and just was eating tofu mostly, and substances like that, and I just have no idea how to deal with this. And I'm wondering what you think about a diabetic on starting a plant-based diet, which is all sugar, without the protein filter, let's say. Am I clear with what I said?
Well, I think what I'm hearing, is it type 2 diabetes?
Yes.
Yeah. I would avoid the tofu, which is really 40% fat.
Okay.
Was one thing that because remember, one of the things that seems to happen, and this is what I learned from my good friend Neil Barnard, in type 2 diabetes, the insulin can no longer escort your glucose into the muscle cell, because the muscle cell has gotten so filled with fat. But then as these patients begin to lose weight, and even especially when they begin eating plant-based, as the muscle cells fat becomes metabolized, and it's like glue in the cell. When the insulin comes along to put the key in and turn the lock and escort the glucose in, it can't do it because the fat is the glue in the lock. Once that fat gets metabolized out, then it's easy to turn the key in the lock, glucose, and the diabetes either decreases or it goes away. That's been our experience. How long were you with it?
I was just with it for 2 weeks.
Wait, if you've taken 55 or 60 years to make a disease, you might give it a little bit longer. Yeah.
Thank you so much, Dr. Esselstyn. I have a quick question. My father had been diagnosed and had a major heart attack at 45. And he passed from heart disease and congestive heart failure. And he has been at a young age through the invasive procedures of stents and triple bypass. And the doctors really just kept telling him, you got to change your diet, you have to change your diet, but really didn't spend enough time. And really when he didn't listen to them, they kind of gave up on him and just let him go through his daily life. But I just had a question of how, because he was an active smoker, how does smoking and cigarettes or drinking or any other kind of drug affect the artery or the walls of the arteries of the heart? Because they're saying it's a significant percentage of patients with heart disease, and a lot of the doctors, they contributed it to his smoking cigarettes, which is obvious, but how does it affect the arterial
Have you
walls?
ever heard of a patient who had heart disease who didn't smoke? What? What?
No, I've
You never heard of anybody who had heart disease who didn't smoke? Yeah, it happens all the time. See, let's go
Right.
back over this again. The reason your father had heart disease is because he progressively destroyed his arteries with the Western diet. Okay. Now, it is interesting that smoking seems to be a risk factor that will hasten this along. However, to your point, if you look at the Papua Highlanders in New Guinea, and they're interesting because when they get autopsied, over the age of 60, there's no heart disease. What do they eat? 19 different varieties of sweet potato. But they have this habit of smoking this harsh tobacco always in these communal hutches. So you not only can get all the wonderful effect of your own cigarette, but everybody else's, but no heart disease. All right? So smoking alone won't do it. You have to have the Western diet with it. It's fascinating that eating those 19 different varieties of sweet potato, guess what? They're not injuring their endothelial cells. Remember? Now, I'm not asking you to go to Papua and start smoking. Okay. Sir.
Hi, Dr. Esselstyn. It's such an honor. Around 2012, just shortly after Forks Over Knives came out, thanks to you and Dr. Campbell and actually your son, Rip, I was inspired once I was diagnosed with a cancerous tumor to actually go to Hippocrates, and I successfully shrunk that tumor to nothing. So to be in your presence today is a real honor. So thank you. But my question is, what is the mindset among physicians that they are reluctant to see a patient like myself and not try to learn and progress and take this to the level that you've taken it? I mean, are you up against this all the time? Is that sort of where we're at?
Well, it's the challenges in life that are exciting. And I think by and large, almost all physicians I know take great pride when they're able to help their patients. But what has happened is that suddenly we find ourselves in medical schools that are being funded by the pharmaceutical industry. And for them to suddenly convert and really have a significant curriculum that is devoted to the study of nutrition, it's very challenging. These things are so embedded. It's tough. But the fact that we are getting this published in peer-reviewed scientific literature, because the reason that this is eventually going to prevail is not going to be because of hype and snake oil. The reason that this is going to prevail is because of science. And I wish I was 40 years old to see what happens in the next 30 years, but I'm really quite confident, and I applaud your efforts. I don't want to come on. I don't want to. Am I in the time of the next speaker? Because this is, look, my father used to say, always be sure you leave when you're most welcome. So. Thank you.